When the government does too much, we have seen a pattern in the past of things that happen. We have examples of England and Canada where the government running their healthcare systems, but also examples in our own country of the government getting involved in things that it's not very well positioned to do. And we see some inefficient allocation of resources, excessive expenses, degraded quality, and bureaucratic rationing. All of these are part of what can happen if the government does too much. In fact, it led to someone to quip, if you think health care is too expensive now, just wait till it's free. Well, one of the things that happen when the government does too much is they tend to make things very complicated. This is a chart that we have that tries on one chart to summarize a 1,000-plus page bill, all of these different groups. The heart, of course, is which is not really a czar, but it might as well be a czar. I think that's either a commissar or czar. We're very, very fond of czars lately, and commissars, I guess, is sort of a form of a czar, but it's telling everybody what they're going to do in healthcare. But this is an organization chart, and I've often thought that we could almost turn this into a maze, and that we could put the patients here and the doctors over there, and we could see and give people a crayon and do it as a doily, and they could see if they could get their patient over to the doctor. I'm not sure whether it's possible to do that or not, but it would make a good maze. So this is a complicated chart that we have trying to depict what happens when the government tries to take over 18% of our economy. Of course, another aspect of that is an objection that the president has tried to respond to. He says, here's what you need to know. First, I will not sign a plan that adds one dime to our deficits, either now or in the future, period. Boy, that's reassuring to have the president tell us that he's not going to sign a plan that adds one dime to our deficits, either now or in the future. That's reassuring if it were true. Well, this is what we've got going so far this year. We've got the Wall Street bailout. Let's see, that's $350 billion. Economic stimulus, I don't think it's really stimulus, but whatever it was mostly just increasing government programs, $787 billion. S-chip at $6.6 billion. Then there's the appropriations bill at $410 billion, and IMF bailout. And then you've got some taxes also. So when you put it all together, we're talking about a total of $3.6 trillion. I don't have a lot of confidence with this level of spending that this idea about one dime, he's not going to add one dime to the deficit when we've got $3.6 trillion that we've already done this year. Somehow this is not very reassuring, this promise that he's made.